What is he? Yeah. So it's just gonna move with. Okay.
Yep. On the live stream.
Yeah. Yeah.
And this time we'll like follow you.
Yeah. Okay.
Didn't know it was tomorrow.
Yeah. It's supposed to like first things not be.
So.
We try to pass it like on class.
Here. But, they didn't want to. So she has a thing that's really. Yeah.
We gonna start. We should still be recording.
Yeah. So that was all. Okay.
We have 20 minutes. And then 10 minutes. That is why I want you to just drop it. Okay. Those like that. So, welcome to Chibu.
Yeah. There you go.
Thank you.
It's hard to now I teach them that. So, yeah.
I'll just introduce. She said.
Yes, okay, yeah. That would have been. Okay. That's right, okay, so yeah. The years run together.
Oh, really? What tribe? I'm from Whiter.
I also got one else.
Yeah.
I got a couple of my.
You know, okay, oh, perfect, yeah. Okay.
Yeah.
Haley, was anybody else behind? Not that I know, I took the elevator. She wanted to push me down the stairs, but. Yeah, which I really.
This guy like came, he's like, you're saying it. I was like, 65. Great.
Might have been.
Alrighty, good morning. Thank you all so much for coming. We're going to get things started with our first presenter, Adrianna, Warden, who will be examining the effects of the Native American population and type 2 diabetes. There will be time at the end for questions, so if you think of one, jot one down as she's presenting. So please help me join my dear friend Adrianna. My name is Adrianna Warden, and today I'm going to be talking about the effect of diabetes in Native American populations. I'm currently a dietetic intern at the University of Wisconsin, Green Bay. So a little bit about what I'm going to be going through today. This is just a little explanation of the points that I'm going to hit. So summary of type 2 diabetes, dietetics field in diabetes, the ethnicity effect, as well as governmental effect. Then the explanation of my 3 research articles that I chose, discussion, my key takeaways, and any questions. So first off, the reason why I chose this topic is my personal interest in this topic itself. I am a descendant of the White Earth tribe in Minnesota, And so that is why I wanted to focus on Native American populations. So first, I'm going to start with the UWGB land acknowledgement. So we at the University of Wisconsin Green Bay acknowledge the First Nations peoples who are the original inhabitants of this region. The Ho-Chunk Nation and the Menominee Nation are the original inhabitants, or are the original First People of Wisconsin, and both nations have ancient historical and spiritual connections to the land that our institution now resides upon. Today, Wisconsin is home to 12 First Nations communities, including the Oneida Nation of Wisconsin, Forest County Potawatomi, Ojibwe Nation communities, Stockbridge Munsee Community Band of Mohican Indians, and the Brothertown Indian Nation. We acknowledge the First Nations peoples of Wisconsin. So a little bit about type 2 diabetes. It is the body's inability to make enough insulin or to utilize the insulin that is produced from the pancreas and leading to high blood glucose levels. It occurs most often in middle-aged to older patients, and it is more commonly seen in Native American, African American, Hispanic, Latino, Asian American, and Pacific Islander populations. So a little bit about the dietetics field in diabetes. Diabetes is a very prevalent issue in today's society. In the dietetics field, career paths can be focused on this disease. So the CDCES, or the Certified Diabetes Care and Education Specialist, is just one route that if you're interested in diabetes care, it requires 1,000 hours of practice in the dietetics field and 2 years minimum active practicing. So a little bit about the ethnicity effect with diabetes and Native American populations. Native Americans are 3 times more likely to be diagnosed with diabetes than non-Hispanic adult white Americans. And they are 2.3 times more likely to die due to diabetes-related causes. So a little bit about the governmental effect that has been affecting the diabetes rates in Native American populations. So the creation of IHS, or the Indian Health Service, was in 1955. And so this served as funding for health services in Native American communities. However, it has had historical underfunding of IHS services and fails to meet the demand that a lot of Native American communities have for healthcare. Going off of that, social determinants of health is a really big factor that impacts the diabetes rate in Native American populations. So a lot of this stems from trauma, either from boarding schools, cultural separation, poverty, federal food programs, and food deserts that are located specifically very close to a lot of Native American communities. And this also goes off of the relocation of traditional homelands. So one impact that has been shown is from the forced relocation of a lot of Native American communities, they were not able to have access to their traditional food pathways where they did and had their cultural practices prior. So they had a lot of impact on changing foodways, or they didn't know how to utilize the food that grew around them. And so that led to the FODPER being passed, which is the Food Distribution Program on Indian reservations. And so FODPER, it is a governmental funded program that focuses around Native American communities. And so this gives basic food staple items to Native American communities, but it included flour, sugar, lard, canned meats, things like that. So they weren't necessarily things that a lot of Native American communities were used to working with or had experience utilizing in their daily food. So my first study is on the patient outcomes associated with utilization of education, case management, and advanced practice pharmacy services by American Indian and Alaskan Native peoples with diabetes. So the purpose of this study was to evaluate the impact that ECP, which is the education, case management, and pharmacy services, and how that has an impact on Native American communities. And so the ECP included nutrition services, health education, and adequate pharmacy services, as well as social workers to help with case management. So in the research, they were analyzing health status and hospital utilization outcomes, both for patients that used ECP and patients that did not. So it was an observational study with over 28,000 people, and it was across, and it was for people over 18 across 15 different Indian Health Service clinics. And so it compared the data from 2011 to 2013. So the analysis, I gave this an EAL score of neutral. It had a basic understanding of what kind of impact was shown. However, as an observational study, I didn't believe I could rate it any higher. So it did have statistical significant improvement on blood pressure reduction and LDL cholesterol, and other benefits that weren't statistically significant but were very close. Was a lower associated onset of cardiovascular disease, end-stage renal disease, and reduced hospital visits. My second study focused on diabetes in relation to serum levels of polychlorinated biphenyls, or PCBs, and chlorinated pesticides in adult Native Americans. So the purpose of this study was to analyze recent research alongside the increase of diabetes in American Indian and Alaskan Native communities related to the PCB exposure. So PCBs were used in industrial and consumer products, such as coolants, lubricants, and electrical equipment, such as LED lights. PCBs were banned in 1979 by the Toxic Substances Controls Act. However, I will go into depth why this ban might not have the impact that was expected. So the Mohawk Nation is traditionally a fish-eating community, and they reside along the St. Lawrence River in northern New York, right along the Canadian border. And so in this region, there were 3 aluminum factories that resided along St. Lawrence River, and they did use PCBs. And so PCBs were found to have contaminated the water source and existing flora and fauna. The reason why this has such an impact is due to the traditional fish-eating community of the Mohawk Nation. They were consuming a lot of fish from the river, and that was a main food source for them. So in the research, it was a cross-sectional design study with 352 adults that were older than 30 years old from the Mohawk Nation that had lived along the St. Lawrence River for 5 years or more. And so in this study, they analyzed the fasting serum levels, blood glucose, and triglycerides. I did give this an EAL score of neutral. I did find that the study was very well conducted, but some aspects of the study could have been improved. So one thing that they used was a screening for diabetes, cholesterol, triglycerides, and lipids. And so blood serum was tested for PCBs in all the participants. And so they cross-analyzed PCB levels along with their diabetes, cholesterol, and triglyceride levels. So in this study, it found that there was positive correlation between patients who had PCBs as well as had diabetes. And so there was no association specifically with Mirex, and Mirex was identified as a type of a PCB. It was used as an insecticide. However, of all the PCBs studied, this was the only one that did not have any association with an increased rate of diabetes. My third study is on the stress burden and diabetes in 2 American Indian reservation communities. So the purpose was to examine the psychosocial stress and diabetes in American Indian reservation communities in both the Northern Plains and the Southwest. So this was also a cross-sectional design study. It had over 3,000 individuals that were randomly selected from 2 different reservations. And so it analyzed a psychiatric, physical, and socio-demographic standpoint. Participants in this study were between the ages of 15 and 54. However, one take back from this is that patients were asked to fill out surveys, so they were self-reporting their diabetes. It wasn't a confirmed diabetes diagnosis. So with that, I gave this an EAL score of negative, just because it was self-reported. However, I do believe that this study was very strong based off of the socioeconomic effect and how that can impact patients. So trauma was categorized by separation from parents, interpersonal trauma, non-interpersonal trauma, witnessed violence, traumatic news, and community distress. So a little bit about the discussion. The stress burden was seen higher in individuals with diabetes. And going along with that, early life interpersonal trauma and community family dysfunction were significantly associated with diabetes in the Northern Plains communities. However, in the Southwest, discrimination and levels of community addiction were associated with increased risk of diabetes. So one thing that's important to note in this is that although both of these communities are both Native American, they have significantly different reasons as to what is impacting their trauma and how that can impact their increased risk of diabetes. So some recommendations that I have are improved quality of care for all. The one thing that is important to note is that, yes, diabetes has negatively impacted American Indian communities significantly greater. However, I believe that if we improve quality of healthcare all across the board, it'll help increase the rate of healthcare access to not only Native Americans, but everyone that might need it. As well as improved funding for Indian health services and overall nutrition services in these communities. One thing that has been shown is that where a lot of Native American community reservations or IHS clinics are located, it is in severely rural locations. And so a lot of the times there isn't as much access to nutrition services or any specialty care. So key takeaways that I have, a variety of factors, environmental, social, physical, can impact the health and well-being of others. And one thing that I would like to recommend is to learn more about going back to cultural practices and food pathways and how that can aid in overall health. One thing that has been increasing in a lot of Native American communities is land back, or they're using a lot of cultural practices to go back to their traditional food pathways. So something that would be very relevant to this area would be wild ricing. So it's a very large food staple in Ojibwe communities, as well as bison or buffalo. Those are some key things that are currently being researched and trying to be widely spread on the knowledge of growing, harvesting, hunting, and that sort of aspect. And are there any questions?
So you had mentioned that you have a personal connection to this. I was curious if your tribe has implemented any of the traditional food pathways that you talked about.
Yes, I'm not sure if you're familiar with Winona LaDuke, but she is a very big activist on the White Earth community, as well as Stop Line 3, things like that. But she's currently running an indigenous seed farm. And so they are working to take ancient seeds and try and replant them to grow the foods that they want. Questions? Okay. Good deal.